In our society over the past decade, the non-medical use of prescription stimulants is increasing significantly and is an issue that needs to be brought to the attention of many, especially college administrators, parents, and students. Prescription stimulants such as Adderall or Ritalin are sometimes used by students who do not have a prescription or used in ways that go against the prescribing physician's instructions, such as consuming high doses, snorting, or injecting. This improper use is considered as non-medical use or drug abuse of stimulant medication. This medication is primarily prescribed to those who are diagnosed with attention deficit disorder, otherwise known as ADHD, and are designed to help the individual with their inattention, impulsivity, and hyperactivity. As a result of misusing this medication, there are legal, academic, as well as potential medical and developmental consequences. Abuse this medication is why. Among college students, there is a widespread belief that stimulant ADHD medication can improve academic performance despite a lack of any scientific evidence demonstrating its success in individuals without ADHD. For this purpose, misusers truly believe that what they are doing is fair and that they are doing it for the right reasons. According to a 2010 national survey on drug use and health report, 30% of students use stimulants non-medically, and full-time college students were twice as likely to have used Adderall non-medically than those who were non-full-time students. In addition, as seen in these tables of recent studies conducted, adolescents were overall less likely to report using prescription stimulants non-medically over the past year. However, the College Life Study shows that 13.3% to 30% of college students have reported to have misused these drugs over the past year. Now the question that needs to be asked is, where are these students obtaining the medication illegally from? One study found that 5.3% of college students were correctly prescribed ADHD medication, while another shows that 61.7% of these students reported to be diverting their prescription stimulants. This diversion includes the illicit sharing, selling, and trading of prescription medication. What many of these students may not be aware of is that it is not guaranteed that the effects of this stimulant medication will improve their grades. They tend to say that they feel more alert and feel as though their cognition improves. However, research reveals that the stimulant medications have no effect on a non-ADHD student's academic performance. Some characteristics or behaviors that are associated with the misuse of prescription stimulants include excessive drinking and/or other drug use, a lower GPA, attention difficulties, psychiatric distress or depressed mood, and skipping up to 16.1% of classes. Responsibility is given to college administrators, healthcare providers, parents, and students to stand up against the growing national trend of illegal ADHD medication use in universities across the United States, especially here at St. Louis University. College administrators should provide a more widespread support structure which integrates academic advising with the assessment of substance use as well as mental health issues. For instance, if a student's GPA drops within a semester, investigate what factors might be influencing the fall. In addition, the amounts of funds that on-campus health clinics receive should increase, allowing them to provide more resources to address substance use, mental health issues, and other adjustment problems that college students may be experiencing. Also, the residence hall coordinator should set up a nurse on staff or a system within the residence advisors so that they can collect all medication and then administer the medication to each of the residents within their vicinity. As for the healthcare providers, they should inform their prescribed users to be mindful of the prevalence of diversion on campuses, include specific instructions on how the medication should and should not be used, and include specific instructions on how to dispose of the excess medication. As for the parents of college students, it is essential that they understand the pressures of college, both academically and socially, and encourage their student to get involved in healthy habits. Finally, the students must understand that there are a few shortcuts to success. Hard work, healthy habits, good study skills, and being able to seek for help will increase their academic performance significantly. All in all, if we spread the awareness of the dangerous misuse of ADHD medication at universities nationwide, we will be able to take a stand against college's most used study drug, Adderall.